Hi everyone, welcome to this fortnightly Tools for Frontline Staff session. We've got three presentations today. So Sajida has joined us from Rooted Finance to talk about the advice and support they offer for residents. Genevieve is here to talk about the rough sleeping women's census. And then Emily May from Homerton should be joining us later on to talk about some free devices that they are hoping to distribute, so laptops, iPads, etc. But I'm going to pass over to Sajida, so thanks for coming along and take it away.
Hi everyone. So thank you, John, for having us. So my name is Sajid. I'm the Advice Manager for Rooted Finance, and we will do a short presentation, hopefully not too long. And if you have any questions, you can ask me at the end of the session. So I'm going to share my screen with you because we do have a presentation that I can share. Windows. Okay, I'm not sure. Okay, can anyone see my screen?
No.
Not yet.
It's saying loading. It hasn't loaded, I don't think.
Okay, let me see if I can do it. I think you did send me the link.
I did, yeah.
The link is as a PDF though, is that right?
It is, yeah. I mean,
Okay.
It's a PowerPoint, but when I sent it to you, I sent it as a PDF so that if you wanted to use it on the newsletter,
Yeah.
you're welcome to do.
Okay, cool. I'll share my screen. Let me
Okay.
know if it's let me know if it's sort of too small, because obviously it's not filling the entire screen because it's a PDF.
Yeah. Okay. See if I can. All right. So what I'm going to do, because I can't. All right, I am going to open it on my end and not share the screen because I'm not able to. And you can share your screen and I'll just go through that.
Sure. Great. Sounds good.
That will just speed up the process. Okay, so we are a free debt advice organization. We are a registered charity. We were created many, many moons ago. So I'm going to briefly go over the last 20 years, how we came to be Rooted Finance. So Rooted Finance started off as a life community project called Money Matters, which was launched in June of 2001 by the government trust in Tower Hamlets through investment from two local registered social landlords in response to rising rents arrears, signalling deeper underlying financial struggles of residents. From 2001 to 2012, we have worked with 9 different RSLs where we helped them develop various innovative and responsive services that remain rooted in the community, setting through trusted networks and collaborative work. Rooted Finance reflects on the community itself through ethical and cultural diversity of staff members and the community work that we do. In 2010, we were registered as a charity and we renamed ourselves as Fair Money Advice. And we were part of Fair Finance, which is also another organization which we have now separated from. And that happened 2 years ago. So we rebranded again as Rooted Finance in 2023. We work with many different local communities as well as registered landlords, local authorities to provide advice. We get different fundings from GLAs, local authorities, community centres. We work really closely with Trussell Trust. We've recently been doing outreach sessions in Haringey as part of Haringey Food Bank. That's been quite successful, and we are currently, because we don't have enough advisors, we also used to do Bexley Job Centre Plus. We no longer are doing outreach sessions there. We also worked with other local authorities in Brent, which we are no longer doing because we don't have enough resources. But once we get staff members up and running, we will hopefully increase our outreach sessions and community work. So what do we provide? So we offer FCA regulated advice to the community through the trusted networks that we work with. We support individuals struggling with multiple debts at risk of losing essential goods and services. We do a individual financial health check, which with people with aspirations and goals, where we will look at their income and expenditure. We will work out, how they can reach the goal, how long it will take. So that's part of Income Max, as well as providing them with debt advice and legal framework of what is their rights when it comes to, say, owing money to the council, rent arrears, etc. We do group smart money workshops, that is jargon-free, supporting peer learning and exchange, and we fully bespoke create the trainings or the workshops that we do with either local authorities or community centres or registered social landlords, depending on the cohorts that they're presenting. So we will have meetings with them. We will discuss areas that they want to aim at, and then we will work out what we can deliver, and then we will run the workshops. How can you do referrals? So we have different variety of how we access our clients. So partner referrals, we use something called the Ellie app. So we are working with a fintech company to create a bespoke system to register clients and then create advice letters. And hopefully what we want to see happen is one system where, the creditors can update, clients can update, and so can the advice centers, where all the information is there, but it's protected by GDPR, so no one sees the information that they're not supposed to see. So at the moment it is growing, but we are using the advice element of it. So it's called Ellie app. The links is on the slide. So if you want to do any referrals, you're most welcome to use the app to complete the referrals. What the transition is and the journey of a client is that we do a triage. So someone refers, we do a triage, and customer engagements where we will call them, we will do an assessment, and we will identify any other areas of needs, as well as housing, as well as immigration, benefits, and we will do signpost and referring. But the debt aspect is in-house, so we will provide the debt advice service. We provide casework support. So casework is once we've completed a debt advice and they have chosen a strategy, we can contact the creditors, we can make applications for debt relief orders, bankruptcies. If they want IVAs, then we will have to refer because we're not allowed to do IVA. And then if there are other areas of needs, we will be in touch with other community organizations or legal organizations to ensure that the advice that we're providing is holistic and tailored to their needs. And if it's not casework, and if we identify the clients are able to deal with their case, but they just need a little nudge or a support, so we create templates, we provide it to them, and we just kind of guide them on what to do next. So I think that's me done. Any questions?
Thank you, Shaz. That was great. Really good to see all your services so clearly set out on those slides. Genevieve, do you want to come in?
Thank you, John. Thank you, Shirley. Say your name again for me. I don't think I've...
So it's Sajda. So it's spelled as Sajida. Spelled as Sajda as the sign.
Thank you. Well, thank you, Sajda. That was very, very helpful. We all know the importance of our residents learning to manage their money well. Do you do this on a face-to-face basis? Is it online? Both?
We do all types of method depending on what the client's needs are. So we do have an office, which is on Cambridge Heath Road. So we do have face-to-face appointments as well as telephone, emails, Zooms, so anything that the client prefers.
Okay, lovely. Thank you so much.
Thanks, Genevieve. I think it was Charlie next.
Hi, Sasha. Thanks for a great presentation. Quick question. I know you're talking about capacity for outreach, yes, and that's been a bit limited. What does that look like in Hackney in terms of your ability to get out in the community?
So at the moment, not so good. So we are taking clients on. We do assessments, and then we provide telephone or face-to-face. But as for going out within the community, in community locations, libraries, where we used to do it before, we used to do it in Dalston, we did it at the town hall, Hackney. So we had various locations with, and we had to kind of like cut back because we didn't have enough resources. So we are recruiting, and once we have onboarded our staff members and trained them, then we will be going back out into the community.
And I ask that you get in touch with us when you're ready to do that, because
yes,
we've been coordinating some outreach across different pieces of advice, like around energy and around housing, across all sorts of community venues over the last year and a half. And it'd be great to not have people starting from not zero, but like building on what's already there. So
yes,
I'll put my email in the chat. It'd be great to link up when you're ready.
No problem. Thank you. That would be great.
Charlie, Abby?
Hi, Saj. Thanks for joining us. And I get the pleasure of working a bit with you all through the advice grants that we run here at the council. And I guess since you work across money advice, financial health checks, debt advice, doing the money workshops, and do that across different boroughs, I'm curious what you all are seeing. What are some of the trends? What are people really feeling right now?
Destitution, desperate, and lacking in hope. So it's everybody that we see are either don't have enough money to top up to get the utilities up and running, they don't have enough money for food, they don't have any money to go out and treat themselves, and that's really important, especially for mental health. And most of our clients have negative mental health, which impacts them greatly. The ability to socialize is impacted, and that has a detrimental effect on them as a family, as an individual. So every client we see has a long story to tell us, and it is difficult to listen to. And subsequently, our advisors have been impacted. And I don't know if you've seen recent reports or spoken to any other advice organizations. There's difficulty about retention, recruiting, and that's the difficulty we're having. Is I don't think anyone wants to be an advisor, especially when things are so tough. And all they do is listen to people who are struggling, like they're genuinely struggling. And it's not by choice. Like, you know, years back when I first became an advisor back in 2007-6, we had clients who overspent, you know, because credit was easy to access. They were able to get loans, credit cards, and because of that, they were in debt. So by choice, they actually fall in because there was overcommitment. What we see now is not by choice, is, you know, utility, rent, council tax, and most of our clients have, I would say 75% of our clients have council tax arrears. And with the council tax arrears, you know, if you miss the payment, the councils are not engaging with clients to see, let's see what we can do to help you. It's like, no, do you know what? You can't pay, then you must pay the full amount all at once. And that's not really helpful. And that's what we're seeing a lot, is that the debts are being passed on to enforcement agent, where they're charging a lot of money. And that's the difficulty and we as advisors also have really hard time trying to negotiate with enforcement agents, because that's a statutory debt and they feel like they have more rights over if someone's able to pay, or they don't want to take that into consideration. And that's the difficulty we're having.
Thanks, Saj. I'm really glad Neil's put his hand up, because you were talking about council tax, and that falls under Neil's what's the right word? Neil's team. Neil, please come in.
Really, I'm quite proud. I go with my colleagues in my team, yes. Well, I'm going to pick Rain for future emails, John.
Yeah.
Hi, Saj. Yeah. Just to dispel a bit, we don't go that quickly through the process of getting to enforcement agent, but I just was I'll drop my email in the chat. We're working on at the moment a pathway for trusted partners to contact us directly for residents who don't engage with us directly. And we understand why they often think we have more power than we've got. They often think we're responsible for things we're not responsible for, and we get a lot of blame, which is fine. We'll live with that. We're not big horrible ogres, but we understand why they don't want to engage with us directly sometimes, because it's just not something they're comfortable with. So yeah, if I put my email in and then reach out to myself or John, we're not up and running just yet. But if we can build that relationship whereby if someone's talking to you or your team, we'll take from you at face value what you feed to us, and then we'll try and work to get that resident on the path to, if not paying the arrears, at least getting the current year under control. And also within the team, and Jonathan's in the call, we've got a team who will help and direct in terms of possibly additional benefits they might be entitled to. So we're trying to deal with it. And I hate this word holistically, because it just doesn't sit with me very well. So yeah, really good you came on the call. And if you've got it, without opening myself up for lots of emails, if you've got something that's absolutely pressing, just email me and we'll see what we can do.
Amazing. I have a particular client, very elderly, so I think I'll reach out to you.
Reach out to me on that. Yeah, obviously we'll do our best to help. it's that balance of, and I don't think we're speaking out of turn, it's a balance of the council's finances as well as the residents. And I'd much rather go after those who can and work with those who can't to get them to a position where it works for everyone. So yeah, if I can just say one thing, do talk to us as soon as, if you advise residents to talk to us as soon as possible. I get that easy, but yeah, that'd be brilliant. Thank you.
If you can put your details on the chat, I'll just take it.
I'll put them in now, but I will be monitoring how many emails you send me.
Okay.
Thank you so much, Neil. That's really helpful. And yeah, just to piggyback on that, yeah, it's Neil's referring to this escalation route that we're working on for trusted partners to sort of escalate urgent or vulnerable cases related to council tax. So we are hoping to launch that sort of in the next few weeks, hopefully. So if that's something that you and Rooted Finance would be interested in being able to access, then we could definitely
we would most definitely be
bring
interested.
you on board.
Always working on trying to build a collaborative network where we can pass information without having to go through like a formal complaint route where we have to make a complaint. I don't think it's good for either parties to waste resources that is really hard to come by. So, you know, if we have a case and you're able to deal with it, I think we would like to see that done through that way. So yeah.
Fantastic. Sounds good. Genevieve.
Thank you, Sajid. I was just wondering, you know, with the clients that you're seeing, are you noticing, especially Hackney has just become ridiculously expensive when it comes to rents. Council tax everywhere is going up and will continue to go up, looks like the maximum for a while. So the idea of affordability, is that discussed, that how do they increase their possible income or reduce their rent?
So we work with individual clients and family members if necessary. So we talk about, you know, income maximization. That could be through benefit, that could be through council tax reduction, a single person's discount. You know, if they have like a spare room, then we will talk about renting out the spare room, but we would need to advise them around any legal implications and them needing to speak to the landlord, any additional benefits if they have health issues, so limited work or work related activity or PIP. So there's lots of things that we do in order to help them. And so we see less and less people with the ability to maximize the income. So it's more about kind of refining the expenses. So if they have like lots of expenses that they can reduce. So, you know, last week I had a client who was paying gym £42 and had a deficit budget of £32. So we're like, you know what, maybe, so we don't say you have to, we use terms like, you know, you may want to consider, you know, not having the gym membership for a couple of months while your situation improves, you know, because if you stop making the payment for the gym membership, which is £42, your deficit would go away and you'll have £10 disposable income to be able to pay something towards the debt. So there's elements of lots of different things that we talk about, you know, looking at cheap alternatives to mobiles, contracts, utilities. We do use switch, compare. So it depends, you know, what they need and what we can provide.
Do you ever refer clients to Hackney Works to support them in enhancing their job skills, job training, or even consider, you can't afford to live in this bar, you need to look to move?
So we've got, so when we have clients with rent arrears, and that's more for people who are renting privately, because someone who's on a registered social landlord might not want to move and get a private, because it doesn't make sense. So we talk to individuals who are renting privately, and we will talk about, you know, maybe looking at alternative cheaper properties, house share. And most of our clients that we've suggested these to, advise these to, would be like, no, my whole life is where I live, so I can't really move out, or I work here, how can I move, how am I going to travel? It doesn't make sense because, you know, jobs are really hard to come by. So we do have conversations, we do think about it. So and most often it's not very suitable, but yeah.
Just a point with the Renters' Rights Bill coming in, once that passes, all ASTs will become assured tenancies. So people who do have a registered provider or something, or maybe just a social property, you know, those tenancies will immediately become assured tenancies. So the private rental market is not so temporary as it was considered in the past.
Yeah.
And these are things they need to realize, that even a move now could very well turn into something long term. Anyway, thank you so much for your time, and it sounds like you're doing a great job.
Thank you.
Thanks, Genevieve. Charlie.
Sorry, I was trying to find the unmute button. I was just thinking about some of the offers that might be helpful to signpost your residents who you're working with in Hackney. And one of them is the work of the Hackney Energy Advice Team, because we know that bills are rising in terms of energy and will likely rise again in winter. And we've been working with an organisation called Crew Energy to deliver advice across the borough about how to maximise income specifically around energy. So I know that you'll probably do some level of energy advice as well around what rates to be on, but also we're able to give out some energy saving equipment, which can save residents huge amounts of value. So I was just looking at some of our calculations recently, and I think in this year we've given out, since January, we've given out 489 draft excluders, which are a low estimate, means about £9,780 of saving for those residents, not individually, obviously, but across the piece. So, I mean, I've just put a link, or have I yet?
Yes, you have. I've just copied it, yes.
To our page. So we'll have some public facing sessions, so either in the Hackney Service Centre or in different places in the borough that we'll go to deliver that kind of advice. But we also do that in collaboration with different community sessions. So if you email us.
So if we had clients that are interested and said, oh, can you do a workshop for us? That would be something you would do?
Vouchers, we'd need to obviously are specific to each resident, and we need to check eligibility. So we couldn't guarantee someone a voucher.
In workshops, if we said like we have a group of people that might benefit from a workshop for energy saving tips.
Absolutely, we could look at doing that together. Let me email me about that as well, because we've got the capacity to potentially do that. We fund Crew Energy through a specific fund, which means that some of the output does have to be for Hackney residents. However, I'm sure we can have a conversation about how we could do that equitably and not exclude people in a way that doesn't feel unnecessary. But yeah, get in touch. We can definitely have a conversation about that.
Thank you.
Great, thank you, Charlie. Really good idea. Does anyone have any other questions for Saj while she's here? Abby?
This is a little bit leading only on the, because when Jahanara from Rooted Finance showed me the EliHub app and what you were all developing there, I was really struck by how you were trying to make it work as best you can to support the advisors to meet residents where they're at, to know about any of their background that would be really especially important to be aware of when working with someone. So for instance, the system, its flagging mechanisms. I wondered if you could speak to some of the way that system has been designed so that you can really try to work as person-centered and
okay.
Yeah.
So it's still a work in progress, actually, shall I say. So we are, every day we're making changes, because, we make changes, then we realize that's not really working the way we want. So basically what Abby's saying is that's the system we're trying to create is client-centered. So we're focused on the client. We want to have all the, the health issues, the debt issues, everything in one system, and to help advisors then to advise seamlessly. So if we noted the client has health issues and we need to adapt, then it will flash if we haven't adapted or made notes onto what type of adaptations that needs to be done. If we've ticked that the client has a certain type of debt, then it would amalgamate that into an advice letter. So as advisors, as FCA regulated advisors, we have to provide advice letters to clients that we see. And previously, where we used to be MAP funded, our advice had to be very, very comprehensive, and we've kept to that model. And so advice letters can be about 80 pages long, approximately, give or take. Yes. And our advisors used to create those. So sit there, read through everything the client presented. It has to all go into that advice letter. What EliConnect has done for us is that it's helped us integrate the advice and the information that we need to give to clients. So we record that onto the system, and it generates the advice letters with the information that needs to be on there. The reason why it's still a work in progress is there's like lots of teething issues. So we need it. We also want, you know, some aspect of benefit things that inserted, so that, you know, if we recognize that they can go and claim benefits or can do a benefit check, that should be able to be easy enough for any advisor or the client to log in and to do that. The client has a separate login details where they can log in and see any communications that needs to be done. And then the third step would be if we introducing the creditors, where we send letters to the creditors, the advisor can, the client can then see that. We haven't gone to that stage yet. We're still developing the core bit of, like, you know, the consent, the name, address, you know, the family, health issues, debts, income and expenditure, any recent changes, or, you know, the next 6 months, are there going to be any changes where the advisor needs to take into consideration whilst providing the advice. So for example, if the client is on maternity leave, are they returning back to work? That means, you know, the situation is changing. So there's lots of intricate details that goes into providing advice. So it's not just what they say to us, is everything that is presented with that being said, if that makes sense. Yeah.
Thanks. Has anyone else got any other questions before we move on to the next item? No? Okay, thank you so much for coming along, Sajda. It was really, really good presentation and great discussion, and glad you've been able to make some connections with Neil and Charlie and other people on the call as well.
Yes.
Cool. Okay, next up we've got Genevieve, who's going to be talking about the women's rough sleeping census. Are you able to share your screen, Genevieve, or do you want me to?
I can do that.
Cool.
That'd be lovely. Thank you. So let me get it done. Of course, I've just finished reviewing it. It's at the very end. Okay, so the Women's Rough Sleeping Census has been going on for about 4 years now. This will be the 4th year in 2025. It goes on all over the country. There's a big push for it in London, especially. And this is really to sort of reach out to you if you don't know about it, get you a little bit more information, and see if there's a way you can get involved and support us. So like I said, the whole point about having a women's rough sleeping census, alongside every year there is a annual street count where we go out and officially count who's seen bedded down on the streets. And those numbers are published, and that's been going on for quite a while. Sadly, though, we know that women just don't sleep on the streets as much when they are homeless due to the safety issues. They are hidden. They will trade many times sex for a place to sleep, drugs for a place to sleep. They will walk all night long and then have no place to go in the day. They will stay in on buses. They will stay on police stations, in emergency areas. And so we're trying to gather data, and we'll do it over a whole week. This gives us a chance to really reach out to these women, and the participation of our community sector organizations is very key, because many, many women are dealing with other agencies out there. So I wanted to really speak today about those of you who may be working with women who you know are either sleeping rough now or have slept rough in the last 3 months, because the whole point of this is to gather the data so that we can create better policies and better support for these women. The actual census will run the whole week, starting on Monday, the 22nd of September, through the following Sunday, the 28th. There will be outreach teams, the Hackney outreach teams, Street Homeless Outreach, as well as other community organizations outreach, who will be speaking to women that they know of. But we really want to focus on these high-risk women who are going into their GP surgeries, who are involved in sex trafficking and have some support there. So really it's to find out from those of you that may be dealing with women like this, is to sort of be aware of how you have a list of people that you deal with. Are you up to date on women? Can you think about ways to, as you see women over the next month or two, let them know that there will be an upcoming census? Would they be available for you to speak to, or refer them to a place where they can be interviewed? It will, all the interviews and the staff we make available and the volunteers that will be available to support organizations like yours will all be women. So it's, if you can sort of keep that list handy, identify those women who may be rough sleeping, victims of against women and girls organizations, drug and alcohol services, migrant support working groups, any service can join. We have the baby bumps teams also supported us last year, who deal with many street homeless women who are pregnant. And the one thing to let you know is this is an anonymous survey that we conduct. And then we'll ask them about 10 questions. The whole link for all the questions will be made available quite soon. I think all the live documents for 2025 will go live next month. But after we've gathered all the data during that week, we then have a post-census meeting where we gather together the organizations and try and see if we've got any duplicates. And then we really come up with our account that we submit back to. Solace Women's Aid is the lead on this and has been for years, highly supported by the Mayor of London, as well as the LGA, Local Government Association, and Single Homeless Project. There is detailed guidance, and there will be detailed guidance. I'll give you some of that today. I'll be the lead for Hackney. I was last year. There will be £10 vouchers available to give to women who participate in the survey. That's gone up this year. It's been £5 in the past, but as we know, £5 isn't much. £10 isn't much, but it could get them something. We will have designated space in the Hackney Service Center. Last year we reserved one. We have a pod on the ground floor where women can privately be interviewed. The year before we tried to send them to the greenhouse, but the greenhouse really had no private area for women to be interviewed. Not many women don't always feel safe at the greenhouse. So we're doing it at the service center. Other organizations are also providing space. So if you either would like to support by giving us a list of people to contact, or you know of women, or you have a space where you would like to interview your women, we will give you all the training and the documentation and the vouchers that you need to participate. Again, it will all be anonymous, both for the participants as well as the organizations that support us to gather the data. Nothing will be shared. It will be put out in a final report, and that final report should be published on July the 3rd. 2023 report is available to be reviewed, looking at the numbers. When you compare the numbers that we get from the women's census versus the numbers that they get on the night count, it's almost triple, more than triple are counted during the week of the survey. So please let me know. My email is here. The slides will be shared. I can put them in the chat today. But if you can plan for your involvement, reach out to me with any questions you may have. Let me know if you're interested in joining. Here's some Solace at Women's Aid Organization has more information on their website. You can email them directly, but feel free to email me as the Hackney lead. And I just want to click on this here. There's training coming up. The next training is July the 3rd. But as you can see, show this tab. There is training coming up on July the 3rd. And then it's going to be training specifically for outreach teams, training specifically for building-based teams. Then there's going to be a drop-in session, another drop-in session, final drop. There's quite a bit of training and communication available. The other thing I wanted to show you is, I'm going to share this one instead. This is the second link on that last screen there, which is really more details about what happens in the census, who is the census for, how it works. I've given you just a brief overview today. We have our local insights meeting after the event to make sure the data we have is as, cleaned up as possible. And then what will happen with it, where it will be collated and reported. There's a link here to the 2023 census, which is very, very interesting. Nothing will be shared about your service or its participation. Excuse me, I'm going a bit hoarse. And then the definition of rough sleeping, what it's about. This is quite a lengthy document with lots of information about what's happening and how we build up to the final week for the census itself. So that's really it from me, unless you have any questions. But John can share the slides. I can share the slides today. Reach out. We'll go from there. And thank you very much for your time.
Thank you, Genevieve. Great presentation. Does anyone have any questions for Genevieve? Oh, you're mute, Saj, if you're talking.
Oh, sorry. No, not a question, but I'm really excited to see the report and also see how we can work with you. But we don't see many actually females that come to our service that are rough sleeping. But I would like to have separate conversations to see how we can get involved. That would be great.
That'd be lovely. Thanks, Saj. Yeah. Charlie?
I just wanted to say thank you, Genevieve, because you've presented twice this week on presentations we've invited you to. And it's just a testament to how willing you've been to try and get this to as many different parts of the system that could be involved. So obviously we don't always know where homeless women might present. So just a testament to you and the way you're approaching it. So thank you.
Oh, thank you. And there will probably be more. We'll have some comms, social media. It's something very close to my heart. And so anytime. So thank you very much for your time.
Thanks, Charlie. I was actually just going to say, are you in touch with Hannah, who's leading on the TA project? Hannah, who's in mine and Charlie and Abby's team.
I need to see if Hannah's on my list.
Yeah, because she's doing she's organising some outreach drop-in sessions for people who are in TA.
What's Hannah's surname?
I think it's Addison K, the email address.
Yes.
I can send you it. Obviously, the people she's supporting now are obviously aren't rough sleeping now because they're in TA, but they might have, because you said anyone who's been rough sleeping in the last 3 months. I'm just thinking they might have recently been rough sleeping and ended up in TA. So just a thought in terms of she might be able to spread the word.
Sure. Lovely, thank you.
Cool. I'm just looking at the chat. Anyone else have any questions for Genevieve before we move on? Oh, okay, great. Thank you so much, Genevieve. That was great. Oh, Charlie.
Hi, Genevieve. I know you've shared your list that you've reached out to me before, but I'm just thinking again about where people might present. Do you have quite a few? How many contacts do you have at the Homerton? There, you have a few, don't you?
Yes, we do have Homerton there on the list, and we do have the greenhouse, but they're going to refer them back to the service center for interviews. Okay,
good. I'm sure, like I said, I'm sure you've got a lot of this crossed already. I was just having a think.
No, that's all right. It's getting into the NHS surgeries. I also want to get into, and just other organizations that deal with women. Sometimes it's not only women, but they are aware of women rough sleeping. The sex workers organizations are usually a good support group as well.
I'll send you. Do you know Rachel Wicks? I'll send her details.
Yes.
She's the neighborhood lead.
Yes,
okay,
please do.
Rachel. Yeah.
Yep. Lovely.
Nice one. Thanks, Charlie. Okay, great. Let's move on. Thank you, Genevieve. Emily May is here, who is from the Homerton, speaking of the Homerton, and she's going to speak to us about some devices that they are distributing. So yeah, please come in and tell us how we can hopefully access and support Emily May.
Perfect, thank you. Hello everyone, my name is Emily May. I am the Digital Inclusion Project Officer at within Homerton NHS, but we cover all of City of London and Hackney. We were a team. That team, as of next week, will be just me. I am a part-time project officer in digital inclusion. So I am going to be the primary kind of point of contact, anything relating to this that I'm about to discuss. Really excitingly, at the moment, we currently have a number of devices that we can give out to residents in Hackney for free. This includes mobile phones and laptops. The deadline, we've kind of got a form, which I'm going to put in the chat. The deadline is this Monday. However, if this is the first time you're hearing about this and you're like, but I have about 10 people I want to submit requests with, please drop me an email and we will come up with an arrangement, just to give you a little bit more time. That's okay. Our only requirement is that they are over 18 years old and that they live in either Hackney or City of London, and they are on low income. I will not check for evidence on what low income means. Low income is how it's interpreted by the professional and person themselves. And that is pretty much it. So it's the form has to be completed by a professional or member of staff from an organisation or charity. And once we've received all the forms, we're going to go through them all. We want to distribute them equitably, so it's not all going to go to kind of one demographic or one cohort of people. We want to distribute them kind of evenly as much as possible, for all sorts of reasons why people may be digitally excluded at present. And then once we have decided kind of who which requests we want to approve, we'll get in contact with the person who completed the form. So it will be the professional, and we'll let them know the outcome. If it was a successful outcome, we will then arrange a session for us to meet with both the professional and the successful recipient, and hand over the device after completing a few forms. We have tried to make it as simple and easy as possible for both the professional, but also make it even easier for the recipient so that they don't have to complete long, lengthy forms. That's for the professional to do. And that's pretty much everything. Along with that, we're also looking at creating some digital inclusion training, specifically for professionals to understand, as they come across service users who are digitally excluded, we know how hard it is for a professional to support that person to access public services, and including healthcare benefits, housing. So I want to kind of create a up-to-date current digital inclusion training for professionals to understand what the routes are, what's expected, how easy it is to access these services for their service users who are digitally excluded. That's pretty much it. In terms of the training, I probably will talk to you, John, about kind of having a more kind of being able to present a little bit more. I want to kind of create it with professionals, so to understand what professionals would really like to know, and what would be useful. So I'll probably, anyone interested in participating and giving some feedback around that, please do email me, because I'm kind of currently collating a nice long list of people who are interested. And yes, any questions?
Yes, I have a question. So is the training accredited, and how long is the training going to take? And have you thought about costs?
Yep, so the training will not be accredited. It will be kind of more bespoke for the organisation, group of people wanting to receive the training. It will be free for any organisation, charity within Hackney who work with residents within Hackney or City of London. And what was the other question? Sorry, there's three.
No, I think you answered all of them. So it's accredited. Oh, yeah. Length of time.
Length of time. I think that will probably be something I kind of discuss with professionals as I kind of create it and understand what's needed. I personally would like it to be not too short, because I really want to go into depth about kind of what is digital inclusion, but also what's happening in Hackney. Who can you signpost? Who can you refer? What are the routes in terms of accessing healthcare if you're digitally excluded? How to access DWP if you're digitally excluded? So kind of going through the kind of frequent obstacles and walls, and kind of working with those services so that I can give pathways to professionals and help professionals to understand kind of what's happening and what's the progress being made, and then also that kind of feedback loop of kind of understanding kind of what are the barriers at the moment and then giving that as feedback.
Amazing. Good luck.
Thank you.
Thanks, Emily, mate. Yeah, both really important pieces of work. And yeah, looking forward to speaking about the training and how we can help for sure. Does anyone else have any questions? Charlie?
Thank you for the presentation. And just so I understand, with the devices,
Yeah.
you're getting all of the queries in and then you're deciding who is most eligible. So there will be people who potentially will apply but then not get them. Is that?
That is correct. We already have a higher number of requests than the number of devices we have. Not everyone's going to be successful, but it won't be. Firstly, it's definitely not a first come, first get. Like, if you put in your application on Monday, that does that you're not at a disadvantage. But also, it's not even it could be someone working and they can't afford a smartphone. Like, it's not going to be almost like the people in the worst circumstances that get them. It's going to be understanding the digital exclusion that happens across Hackney. I'm very mindful that there are projects for specific cohorts and demographics, but not for other people. So it's kind of looking at it across the board and distributing them in that way.
Okay, that's good to understand, because there are many organisations for whom I think would really relish the opportunity to apply. However, I think with that caveat, if you're already beyond the number, I'd worry about how we present. Do you know, understand? There's like, I mean, we could suggest many organisations to reach out to, but you don't want people to feel that they could be disappointed if they do apply. Do you know what I mean? I'm just trying to maybe.
Yeah.
Where I would suggest, have you spoken to like the ones based in health settings already, like Together Better?
Yes. Yeah.
Yeah.
So
Okay,
we've done quite a lot of outreach. I think for those that aren't successful, we also know quite a lot of other projects that are doing device distribution. We also know there's some kind of routes through the government where it's not obvious, but you can apply for device kind of funding. So it will be about kind of like also having discussions around that and looking at ways that we might be able to get that that individual a device, even if we're not able to. But yeah, I would definitely still encourage people to apply. We're always applying for kind of new devices. So even if they don't get it this time, they might get it next time, for example. We'll always keep their information on record if we've got their permission. So we can always recontact maybe 2-3 months down the line if something does come up for them.
Thank you. I'll reach out to a few organisations. I know that Titalaya, who's often on this call, has reached out to John and I before about this issue, so we can go to her.
Which organisation is that? Sorry.
Previously the Long COVID Service, but now Hackney Arc.
Okay. As far as I'm aware, I haven't received any requests from them. So if you could reach out to them soon, that would be useful, because yeah, as mentioned, the deadline's very soon. Thanks.
Great, thanks, Charlie. Any other questions for Emily, May? No. Okay, thanks so much for that, Emily, mate, and coming at short notice, and yeah, really useful to have you here. We've got some time left until the end of the meeting. So what we usually do after the presentations is open up the floor for anyone who wants to share anything that they're working on, anything they want to promote that's available for professionals or residents, or anyone who has a question they want to put to the group. We've always got lots of wide range of experiences and skills on the call. So if there's something that you need support with and want to put to the group, then now's your chance. Neil.
It's not so much something I'm promoting, but just that I imagine most people in the sort of sector of helping residents aware of it. There is a council tax consultation, went live in June from the government. It's up and running till September. It ranges from really, I would say, sort of low-level stuff like, do you get enough information about where your council tax is spent, to should everyone have 12 instalments to pay rather than 10? So for the advice sector, if I can encourage anyone to fill it in, because we won't get change unless we ask for it. We'll be replying as Hackney. What I would say, this is my pinch of salt, and he's not on my Christmas card list anymore, Martin Lewis, but just so you're aware, no council acts as has been portrayed on Radio 5 and other answers. Yes, we could get you to court within about 6 weeks, but no one works the legislation. The legislation allows it, but no one does it. But I can encourage as many of the third sector to go to the government website. I can share the link, but if you just Google council tax consultation, there's only one out there. Don't do the one for Scotland, because obviously we're not in Scotland. But yeah, just want to promote that and encourage people to complete it. That was it, John. Nothing other than that. A sales pitch for the government.
No, it's a good point. I might actually include the link in the newsletter as well, because it would be good to encourage, community partners to complete that as well. Completely agree.
Whether any notice is taken of it, John, obviously don't come back to me on that. But yeah.
Nice one. Thanks, Neil. Anyone else have anything they want to speak about in this space? Any questions, or anything that you think it would be good for people to know about in terms of something your organisation is working on, or any questions you have? Charlie.
I'm going to come in with my standard offer that I normally come to this session with, which is firstly about the Here to Help guide the council produces. We have some physical copies still from a print run we did earlier in the year. If your organisation would like some physical copies of the guide, which includes all types of support, let us know. We can try and get that to you. I hope that's one thing. And the other is, if you would want to explore the energy advice thing I mentioned earlier with Crew Energy, we are looking to start booking August and the winter and autumn now. We're not entirely sure of our capacity. It might be only 2 days a week, but we're really keen to get to as many different places as possible. So if you're interested in either of those things, please email me.
Nice one. Thanks, Charlie. Anyone else want to comment at this point? Emily May.
Hi, sorry. I had a question earlier around kind of capacity. I just had a check, and we still have more phones than applications. So please, especially phones. That doesn't mean if you apply for a laptop now, it could still be approved, because it's not a first come first get basis. So just wanted to rectify that previous answer.
Great, thanks, Emily May. That's really useful to know. Genevieve.
Yeah, I was just going to talk about that. We're asking for community organizations to assess, assessing Hackney's preparedness for extreme heat. And I just wondered if I can share that link now, John?
Yeah, go for it.
I'm just going to put it in the chat. By July 14th, just things we're looking at, especially to respond to those most vulnerable in our borough. And so here it is. Let's see, is the link live? It's not. Okay, I'll make sure that's done.
I'll be putting it in the newsletter as well.
Thank you.
I think you sent it to me and Maya sent it to me as well. So yeah, it will be going out. Well, Chanel will be putting it in the newsletter because Chanel's doing that now.
Okay.
But yeah, we'll put it in there. Thanks for sharing, Genevieve. Anyone else who wants to come in at this point before we wrap up? No. Okay. Well, thanks everyone for coming along, especially for those of you presented. Really good, really good mixed presentations, lots of great discussion as well. So thanks everyone for coming along, and we'll see everyone in a couple of weeks.
Lovely. Thank you so much, Abby and Charlie. Bye.
Bye.
Thank you. Bye.
Pleasure, Hidor. Bye.
Thank you.